Hello everyone, welcome to my channel. Today we have another pediatrics question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 7-year-old child with a history of atopic dermatitis returns for re-evaluation because a rash on the lower leg has worsened over the past week. At a previous visit, a medium-strength topical corticosteroid was started and the family has been using it as directed along with daily moisturizing cream. Despite good adherence, the affected area has become moist and developed yellow crusted patches. The child continues to complain of significant itching but has no fever and vital signs are within normal limits. Based on these findings, which of the following is the best next step in treatment? First things first, we need to think about the diagnosis. We know that the child has atopic dermatitis, but recently we are observing some golden or yellow lesions which are crusty, and that could indicate impetigo, and we have a picture of that here. So basically, when you have atopic dermatitis, the barrier of your skin is damaged, and that makes you susceptible to many infections by pathogens such as Staphylococcus aureus, and that could lead to impetigo. And I believe that to be the diagnosis. With that being said, let's go over the answer choices. A. Replace the corticosteroid with topical pimeracrolimus. Well, pimeracrolimus is basically topical calcineurin inhibitor. They are the second-line therapy for atopic dermatitis and are only used if the patients do not respond to the first-line, basically, medications that we provide them with, and that is not the case here. The case here is the infection, and we need to solve that. I'm not going to go with A. B. Prescribed topical mupirocin. Well, this could actually be used to treat impetigos, so I would say B could be the right answer choice. C. Start a short course of oral prednisone. Well, oral prednisone can be used if you have very severe flares of atopic dermatitis, but we don't use that for children because it could lead to weight gain and suppression of growth. Also, here we are dealing with infection, so oral prednisones are not going to help us that much. D. Begin wet wrap therapy using high potency topical corticosteroids. High potency topical corticosteroids are not going to answer the underlying infection, and also with wet wrapping and using a high potency topical corticosteroid, you can turn the topical corticosteroid into a systemic corticosteroid, and that's not something we always want. So D is not the correct answer. E. Stop using moisturizers and monitor the rash. Well, some moisturizers, because of their ingredients, could potentially worsen atopic dermatitis. But in this case, if we stop the moisturizer, we are just going to make the situation worse. With that being said, I would say that B is the correct answer choice. If you like this video, please like and subscribe. And thank you.